Good morning. Thank you for joining us today for our Mission United, a health and housing system collaboration presentation. I'm Doreen Hume McKenna. I'm the Regional Housing Coordinator for Durham Mental Health Services, Lakeridge Health. I'm a system support position for the region that links the health system and the housing system. My colleagues that are joining us in this presentation are Stephanie Skopik. Stephanie is the nurse practitioner clinic lead from the Canadian Mental Health Association Durham, and she's the clinic lead at Mission United. Erin Vallant is the manager of affordable housing and homelessness initiatives for the region of Durham. So as we move along, my job is to sort of set the stage for you. And then Stephanie will talk more about the health aspects of Mission United, and Erin will focus on more of the housing system considerations. So where are we exactly that we're coming to you today from? We're from Durham region. So Durham region is that green, all of that green area, which is just right next door to the Greater Toronto area. So the region is actually quite large, stretching from Lake Ontario in the south to Lake Simcoe in the north. Where Mission United is really in Oshawa, which is that area that's outlined in yellow. So the region of Durham has about 700,000 people in total. Oshawa has about 170,000 people. When we did our 2018 point in time count, there were 191 individuals who were either unsheltered or provisionally housed. We distribute about 200 meals a day now from Mission United, the backdoor mission. So we think the numbers of people who are experiencing homelessness have gone up. We've just completed another point in time count when we'll know a little bit more. So in Durham region, we acknowledge that we live and work on the treaty territory of the Mississaugas of Scugog Island First Nation, the Mississauga peoples, and the treaty territory of the Chippewas of Georgina Island First Nation. Now I need to get my cursor in the right spot to move along. So today, really what we want to do for you is to share what a little bit about what our experiences have been in setting up and operating Mission United, which is a co-location collaborative hub of different service providers, and talk a little bit about our outcomes and the value of that, and the challenges that we have and that we continue to experience. So the church that you see, the sandy colored building, is Simcoe Street United Church. The lower building over to my left hand side of the screen is the gym that's attached to Simcoe Street United Church, and it's the backdoor mission for the relief of poverty. The backdoor mission was here prior to COVID. And so for a number of years, it provided a social and a respite location for people in the afternoons to come in and get a sandwich, sort of have a social atmosphere. When we needed a location for our Mission United hub, the backdoor mission was in existence, and it was a very influential partner in having in being able to set up Mission United. So at our location, our Mission United location, so we sort of say that we have a Mission United that's operating out of the backdoor mission. So we sort of use those terms interchangeably, as well as calling it the hub, because it is a hub of co-located services. So the key services that are in this location are Kelly and Frank, who are standing in front of the car, our primary care outreach program team operating out of the region of Durham. They go to encampments, they meet people on the street. They're that first engagement with people, and they monitor and follow up with people who are living rough for the most part, or challenged otherwise with their housing. The picture below them is the gym that you saw from the outside that's been converted into the clinic area of Mission United. So the clinic sees about 40 people a day, which is a lot. There are a couple of doctors, a nurse practitioner, and other registered nurses, and other shared services that are there to support the work of the clinic. The picture with the stained glass window is the chapel. So that's our safe sleep area, where people can come for up to 5 hours a day to get the sleep that they weren't able to get during the night. It's also a little bit of a de-escalation crisis intervention area. So we have Durham Mental Health Services, crisis workers, and a case manager there to connect with people, to help them with whatever their situational challenges are, and then to be able to link them with other services if that's appropriate. The picture over here is the Ontario Works people, their support services. So they were a little bit later coming to Mission United, but they're key, because what we found initially when people were coming in was that they were very distressed about their finances. So Ontario Works came, and they are able to problem solve a lot with individuals. They're also able to link people and help them apply for disability benefits in conjunction with the clinic. So they're huge. The other services that we have are the meals that I mentioned. There's a pantry, there's harm reduction, and other kind of assorted things. But those are kind of the main ones. The thing that links all of this together, besides the health services and the crisis, and is that we have a housing thread that links everyone. So every one of these people, every one of these services is really targeting linking people with housing contacts, so that we can be a housing focused service, so that we can engage people and get them onto the by name list, and then engage them in housing, which is easier said than done for many people, as you probably know. So the need for a service hub was sort of twofold. In Durham Region, we have a GAP committee, is what it's called, which is a co-production group of people who are street engaged, as well as frontline service providers. So that group identified about 3 years ago in a project that they called "What Are We Going to Do This Winter?" that there was a need for a hub that people could access to, instead of going from place to place, and maybe the place is closed, and it's difficult to make appointments if you don't have a phone. And so that hub was seen with different services, was seen to be essential to help people access services that they needed. The pandemic, when it was declared, as we know, services were suddenly absent. So bathrooms were absent, places for people to go indoors to warm up or cool off were suddenly closed. And so that was a catalyst for the hub. And it opened about 6 or 7 weeks after the pandemic was declared, which is really a very fast response. So the people that are seen at the hub and served at the hub, the Mission United service, are those people who really were falling through the cracks before. We see a lot of people with mental health and addictions challenges, and who have or are living with really, really significant trauma. So the service is designed to wrap around those needs and try and address those needs within that context for people. Really, it's a matter of establishing trust and hope for people as we engage them to try and help them to change what's not working well for them right now. So Daniel Cullen is the chair of the GAP committee.
Let me tell you of a place. It exists in most cities and towns, and most people try to turn their eyes and say this place doesn't exist. Who am I to say this place exists and most people try to turn their eyes? My name is nobody. I heard a mother say once in response to her child's inquiry, as she pointed towards me, saying, "Mommy, who is that man?" And she said, "Nobody, dear. He's a homeless man." My name is Daniel. I have lived on the streets for 25 years. I have 8,000 days of lived experience. And for the past 21 years, I've been on a journey of rediscovery, self-discovery, and reestablishing myself back in the community as a successful member of the community. And today I work as a peer support worker at the Backdoor Mission United. And that's why I'm talking about the value of the housing helps working model that we have as the poster. I've lived in over 60 different communities over 25 years. And in those places, I would go looking for services. And when I'd find those services, and it would just make it more difficult. So when the idea of the hub came up through discussion and we established the hub, the idea of the hub was that be client focused, client centered, and work as a triage kind of thing and work towards helping the clients through their crisis and establish them to a housing model successfully. We do that in three or four ways. One of the ways is through peer support. That's my responsibility to go out and create alliances with the community and create trust with the community so that they come into our services and use our services. We have the housing. We have the support services where we offer supports and agencies come in and work together. We have the safe sleep space. The safe sleep space gives people an opportunity to rest, who have been out all night. And one of the most exciting things that we have is we have the medical hub, where the medical hub stabilizes people, gives people a safe place to find a place to talk and share themselves with the mental health workers. And when they come to the place that they want to face their addictions, we have medical services and addiction services that are available there. With all these things in mind, the opioid crisis that we have in Durham region, there's a lot of people that have overdosed, and the medical hub has been responsible of resuscitating many people many times over the time of their addiction here. So on a scale of 1 to 10, what would I think the value of the Mission United Backdoor Mission model is that we've created? I'd say at the mission, we're probably out of 1 to 10, we're about a 15. As far as the model that we've implemented and the model that we're doing, 100%. I think it's one of the most brilliant models I've seen in all of Canada. So as far as we go, there is hope if you give somebody a hope that's bigger than the challenge they face.
So at Mission United, we've observed the trajectory that people tend to follow and that we want to support them to follow. At the very end, where the little house is, really is what we hope is the goal for many people. And what the Canadian Mental Health Association talks about is the importance of having a home, a job, and a friend. So we know that it's not enough to just house people, but to give them the tools to reach whatever their goals are for themselves. All along this journey, we're focused on housing. Housing isn't dependent on any step here. It's a housing first model. The Backdoor Mission United has registered approximately a third of the total individuals that are on the region's by name list, or 179 people in the first year. So we've been very successful in linking people with housing. The Mission United model is what's in the gold square. It's that initial engagement. And that's what Stephanie and Aaron will talk about. Thanks very much.